Hello, everybody, and welcome to this week's edition of Ask the Expert. My name is Ashley Baldwin. I work in the Communications Department at the Pan American Health Organization here in Washington, D.C. And today, for International Youth Day, which was yesterday, we're going to be talking about youth health during the COVID-19 pandemic. I'm joined by two special guests. Firstly, Dr. Sonia Cafe, who's our regional advisor on adolescent health here at Paho. Hi, Sonia, how are you? You need to unmute your mic, Sonia.
Of course. Hi, Ashley. Hi, everybody. It's great to be here.
And we're also joined by one of the members of the iThrive group, Therese Ward, who's a youth development professional, former CARICOM Youth Ambassador of Trinidad and Tobago, and member of the Paho Youth for Health group, who's joining us from Trinidad. Hi, Therese, how are you?
I'm great. Hi, everybody. So great to be here.
So as per usual, we're here to take questions from the audience. So if at any point during the next 40 to 50 minutes or so, you have any questions related to youth in the contexts of the COVID-19 pandemic, or you're a young person that has a question about the pandemic to ask our experts, then please feel free to pop it in the comments section on the Facebook chat, and we will get to it as soon as possible. I have a few questions of my own to start with. I'm not going to hog the conversation too much, so I'll keep an eye on the chat. But yesterday was International Youth Day, and this year's theme is Youth Engagement for Global Action. What does that actually mean tangibly? What are we asking for, and what are we asking for specifically in the context of the pandemic? I don't know if Sonia wants to start us off.
Yes, of course, it will be great to hear from a young person as well, what it means to them. But I think this is a very important day, an event in the UN calendar. International Youth Day was established over 12 years ago by the United Nations as a day, a moment, a platform to give young people a space and a voice. And to call on member states to take it seriously, the participation of young people. And this year's topic, I think, is a wonderful topic to think about. How do we engage youth? How do we facilitate that youth become engaged? As the topic says, for global action, meaning how can they influence what's happening globally? And I think over the past months and years, young people have shown us that they really are able to influence the dialogue, global dialogue on important topics related to their health, development, and well-being. And so this year, it's really important for us to take advantage of this moment to reflect on how we as a society in our region, how we are engaging young people to participate on all levels in the development of policy, in the development of programs, accountability mechanisms for their own health and well-being. And maybe if I can add, when it comes to COVID-19, it's very urgent, right? Because COVID-19 has generated an unprecedented challenge for us as a society to address, to try and flatten the curve, to try and get to the other side of COVID-19 in the best way possible. And what we need is the energy, the innovation, the participation of young people to help us get through this challenge.
Therese, you know, as a young person, as unfortunately the only young person at this table at the moment, what does it mean to you? What are we actually asking for? You know, we've had International Youth Days for the past 12 years, as Sonia mentioned. We're talking about youth engagement, which certainly isn't a new topic. But when it comes to the context of the COVID-19 pandemic, what do we need countries to do to ensure that young people are front and center of the conversation?
Fantastic question. You know, youth engagement for global action. The theme in itself, to me, is so very profound. And the thing about International Youth Day is that although it was observed yesterday, it is something that can be a spark that can ignite a massive flame. And that flame can dramatically reorient how we do politics, how we do policies, how national as well as international agencies operate, and the extent to which youths and youthful minds and youthful energies, once meaningfully engaged, can put us all in a better place collectively. And you know, as the United Nations turns 75, and with only 10 years remaining until we can really make Agenda 30 materialized, I don't know who else could move and who else can shake like a young person. Young people, youthful minds, youthful fingers. And for that to be achieved, engagement of youth has to be at its core, now more than ever in the wake as well as the midst of this global pandemic.
And I guess at the decision-making level as well, you know, not just in a symbolic sense, but we really need young people with a sort of valuable, listened to voice in those positions of power, making, you know, calling and making suggestions and calling for change. Talking about COVID-19 a little bit, there's obviously been a lot of attention given to groups that are at particular risk for severe disease. And we know that that's people over the age of 60. We know that it's people with pre-existing conditions, hypertension, diabetes, etc. And there's still a lot of doubts about whether young people are really susceptible to COVID-19. What do we now know about that, Sonia?
That is a very important question, Ashley, because I am also still hearing people saying, well, really, you know, are they really at risk? And even if they contracted, is it a big deal? And the data that we have now is very convincing. And that I'm speaking about the data that Paho is collecting from our member states. In the database, there's more than 200,000 young people registered with the infection, but also more than 10,000 who developed such severe symptoms that they had to be hospitalized, and more than 200 deaths. And these are data from July, so by now it's even worse. And so I think the data shows us that young people are susceptible to contract COVID in significant numbers. They are also susceptible to develop quite serious symptoms, to be needing to be hospitalized, and they have a risk of death. And so yes, I think the data is very clear. Young people are susceptible for COVID-19. But beyond that, we are learning every day. We're learning more about the role of young people in the perpetuation, the propagation of the infection, even those who are asymptomatic, who can carry the infection home and infect their elderly family members or younger family members with pre-existing conditions. Because again, from the preliminary analysis that we have done, it shows that young people with pre-existing conditions, and we have an ever increasing number of young people with obesity, with asthma, with diabetes, are at greater risk to die or to develop very severe symptoms. And so overall, young people are a very important factor in the transmission for their own health and for the health of those around them.
I guess when we look at the COVID-19 pandemic as well, you know, there's been a lot of countries have had to, in order to stop the spread and flatten the curve, as we're constantly reiterating at Paho and other health organizations and ministries of health, implement public health measures. And I think one of those that's been, you know, particularly impactful in a number of ways and across generations probably is the lockdown. So people, you know, having to stay home, people teleworking. We've been teleworking for, I've lost track of time now, Sonia.
Months.
months and months. So Therese, When we look at some of the public health measures that have been implemented, and particularly things like lockdown, and when, you know, schools have been shut, universities have been shut, etc., etc., apart from the sort of biological and medical side of the pandemic and those implications, do you think that young people and, you know, yourself, your peers have been affected in a different way by the COVID-19 pandemic compared to older generations?
Absolutely. I believe that the COVID-19 pandemic, it stopped us in our tracks. I mean, our lifestyle typically is one where we are outdoors, we are outside, we're outside for school, for church, for entertainment, for socializing. So it was a dramatic shift, you know, and it could possibly cause increased feelings of loneliness, depression, mental health challenges, and plain old boredom. But I think it has also been a call for us to reorient how we do things, how we do school, how we do church, how we do lives and parties, how we do meetings, if we do meetings, because some could just be an email, and how we do life. So, but apart from that, there are a lot of youth that are also essential workers that are involved and volunteering themselves to really support their community in the midst of this pandemic, in the midst of the response plan. Some are working in hospitals, some are working in testing clinics, in research centers, and others are working on advocacy as well as risk management and other initiatives to sort of promote healthy lifestyles, such as the hashtag wear a mask, hashtag wash your hands, safe hand challenges. And, you know, if I can just go back to what you were saying about the doubts that young people have as it pertains to really contracting the COVID-19 pandemic. Now, as a young person, I have no doubts. You know, in the earlies, it was sort of a conception that soon turned into a misconception, because then the virus was new, it was novel. But as things progressed and more research and studies were conducted, it was clear that COVID-19 does not discriminate at all. And, you know, it's sort of just like when people think themselves as invincible. I'm invincible from death. I'm invincible from getting involved in a car accident, although I'm speeding, although I'm drinking and driving, or although I'm not wearing a seatbelt. So similarly, I think people think themselves as invincible from contracting the disease, but that is not the case.
Maybe if I may add, Ashley, to this excellent response from Therese, that what Therese was mentioning about young people's lives outdoors, being with friends, etc., is not just something that sometimes we blame young people, saying, oh, they only want to go out and party and stuff. But in effect, this social development is an essential part of the development of young people. And so it's not just because they want to go out, but it is driven by their process for development and to develop the skills for healthy relationships across the lives. And so that, I think this is why young people are affected in a different way, because all of us like to go out and have fun. But for young people, it's essential to learn, to socialize with others. And so we see that during adolescence, young people begin to reach out to others outside of their family circle because they need this interaction to develop in a healthy way. And so as Paho and as other partners and governments, we all need to help them find ways to replace mechanisms and what Therese was saying, mechanisms and ways to replace this limited action they have with other ways to have this social interaction that is so necessary for healthy development.
There was a couple of words that Therese mentioned during your answer as well, which was, you know, isolation and loneliness. And I know that we've spoken about mental health, particularly in previous editions of Ask the Experts. And, you know, there's a very fine line between those sort of, regular expected feelings when your life changes very abruptly and you're suddenly, having to conduct all of your socializing and working and what have you in the house, unless of course you're a key worker or a frontline worker. What are our recommendations for young people who are experiencing some of those feelings, but perhaps those feelings are becoming a bit more all-consuming?
Yes, if I may start, they're very clear recommendations, again, based on experiences with previous emergencies and the expertise of mental health workers. There are a few things that we do recommend. One is that we need to acknowledge that young people have these feelings and that it's normal to feel that way. It's normal to feel anxiety when your life changes so abruptly, as Therese mentioned, and then finding ways to provide services, to provide that support that young people need. Of course, it starts in the home with the family, for parents to provide this opportunity for young people to express themselves, to discuss their feelings. And these can be feelings that range from very mild feelings of unease to quite severe feelings of anxiety and stress. What's going to happen to me? What's going to happen to my future? Or if a loved one passes away, the sadness. So it starts in the family, but it has to go beyond that too. In some countries, there are now mechanisms where through telemedicine, young people can access counseling services. I think those mechanisms are very important to encourage young people to participate, and to use these services. And then the third recommendation is for young people to learn very simple coping skills, to have a routine, for instance, a routine of their day, to not sleep in the whole day, and then to do the things that they need to do in an organized way, almost as if there was no COVID, to stand up at a certain time and have a rhythm to their day, keep up with schoolwork, stay in touch with friends through social media, through telephone calls. So those are some of the coping skills that can help young people to deal with that anxiety and sadness and stress that might be generated by the COVID-19 containment measures.
Therese, you're really going through it at the moment, as many of our young people in the Caribbean region, particularly. What are your recommendations for your peers who are starting to feel some of those more sort of pervasive feelings of anxiety and isolation and loneliness? How are you coping?
I just think Sonia really hit that nail on the head. Especially Sonia, when you said they need to stand up at a certain time. To be honest, that was the first time I heard somebody use the term stand up. You would usually think just get up at a certain time. And I think it's important that you said that, because sometimes you're up, you're not sleeping, but you're on your bed and you're on your phone and you're scrolling through Instagram. And I think that is such a damaging way to start your day, because when you do that, you're not really starting your day, Your social media feed is starting your day for you. You're consuming so much and you can't really take control of your day. So it's really important to stand up early, get what you have to do, get it done by, creating a to-do list from the night before, and put things in place to make sure that the chaos could be happening around you, but it doesn't need to happen within you. Make sure you have control, at least, of your own space, of your own schedule, of your own agenda. You can't control the borders. You can't control the proliferation, at least in a large extent, of the virus. But what you can do is control your life, control what you do, what you can do, reach out to friends, make sure everybody is going okay, and try to engage in really productive activities. Try not to waste away your day and waste away your life. And I'm not saying that social media or even Netflix is unproductive, but you must have some sort of balance.
Okay, I'm going to have to check myself there. based on those recommendations. So just a reminder for people that have joined, we are here with our latest edition of Ask the Expert, talking about youth health during the COVID-19 pandemic. I'm joined with Dr. Sonia Cafe, our regional advisor on adolescent health here at the Pan American Health Organization in Washington, D.C. And joining us from Trinidad is a member of the Paho Youth for Health group, Therese Lord. If you have any questions about youth as it pertains to COVID-19, please pop them in the message box and we'll get to them throughout the course of this session. So we've spoken a little bit about sort of the general, I guess, malaise, for want of another way of putting it, that everyone is feeling, really, given the public health measures that have to be implemented to flatten the curve, and particularly young people. And you mentioned, Therese, that it feels like everything has come to an abrupt halt, which is true. When we're talking about school particularly, you know, that's also something that for many young people has completely flipped on its head with, you know, e-learning and learning from home, you know, if they happen to have an internet connection, and we're aware that there's many young people that don't have access to those tools. And a lot of people are concerned about the effect that long-term school closures are going to have on the health and development, which is something that you mentioned, Sonia, of young people. Are these concerns justified? You know, we're in month 5 or 6 now of lockdown, I guess, and for many countries and many communities, we still don't see an end in sight. What are the implications on health and development and education, I guess, for young people that are still at school or are still in full-time education?
You want to start, Therese?
Yes, by all means, I believe it is justified, because I myself am very concerned about that as well. There is tremendous pressure on parents and teachers, and especially the students. You know, I can't even imagine being a student right now in the midst of a pandemic. So much uncertainty, so much anxiety on top of an already heavy curriculum, much of which you don't really put to use in real life anyway. But, you know, yeah. So I have this friend in India. So he's also a youth. He's doing his PhD. And he went to do his exam just day before yesterday. And they told him, because of the pandemic, sorry, come back tomorrow to do your exam. So he came back tomorrow, which was yesterday, to do the exam. And they said, sorry, because of the pandemic, you have to come back today. So, I mean, exam, you know, the stress already that is leveled upon you when you have an exam, and now the pandemic is actually affecting your studies and affecting your ability to physically write the exam. To me, that is immense, and I think that really messes with you. And especially for the younger ones, you know, in primary school and secondary school. But to be honest, it doesn't make a lot of sense to sit and worry and to sit and wait. We really have to be there for each other. We have to sort of gather our frills, come together and assist each other. Family and friends can, you know, lend a helping hand in terms of tutoring, assignments, distance learning, because there's not much that we can do in the bigger context, but we can do a little at a time. As there's a saying in the Caribbean, one wonderful basket.
Excellent. I fully agree with you, Therese. Another concern is as well that young people, again, the social environment that is the school is lost. Beyond the learning problems with, indeed, when am I going to take my exam, when am I going to graduate, but the school is a very important social environment for young people's development, learning life skills, etc. And again, the closing of schools is affecting that. And another worry is that our region is not doing great when it comes to school enrollment, retention, and graduation, especially when it comes to secondary and tertiary levels. And so there is a worry that we will see an increase in school dropout because young people will try and look for a job or because of the circumstances at home, they might not go back to school. And we know that education level is a very important social determinant of the health of young people. Young girls who are not in school have a higher risk of unplanned pregnancy. Young girls and boys who are not in school have a higher risk of encountering violence, accidents, etc. And so there's a direct relationship between education and health. And as Therese said, I think this is the time for us to again acknowledge that there are some risks here that are associated with the school closures. Even though we have to balance the risk for infection and managing the pandemic, the safety with the health and well-being of young people. But how can we make sure that we help young people to keep up with their learning process, keep up with their social development, and ensure that when the schools reopen, that young people come back. And I'm especially worried about young girls who might now have a place in the household, and some families might say, oh, you don't have to go back. Make sure that they come back to school when it's safe to reopen schools.
I think, obviously young people and everyone really has a lot of worries about, the implications that these sort of delays are having, or that the lockdown is having on education. And, you certainly highlighted, Sonia, this issue of making sure that when lockdown is lifted and when we don't have to implement these school closures and other public health measures, that young people go back to school and that route back to school is facilitated. But then again, we have other countries and other contexts where schools are reopening. And there's a lot of young people very concerned about having to go back to school. Is that justified, do you think? And what are our recommendations for those young people? Is it safe to be going back to school, I guess, is my question to you.
Right. So that is indeed a question that is coming up more and more, as you say, because in some countries, in some communities, schools are beginning to consider reopening. And there are some guidelines that have been developed and published by the World Health Organization. I hope we can put the link to that in the chat for people who would like to review that. And also UNESCO and the joint UN agencies have tried to do a lot of work through webinars and other means to share the information and guidance on safe reopening of schools. There is no blueprint that will fit every context. So school reopening, safe school reopening will have to be addressed in the context, the local context. And that depends on the status of the epidemic. But it also depends on the capacity, be it existing capacity or to be developed by schools, by educational systems to apply certain measures that have to do, for instance, have to do with all the prevention measures, the distancing, hand washing. Is there water in the school where young people can do frequent hand washing? Can they physically distance? How is there a protocol to deal with students, teachers, other staff who might be ill? So there's very clear guidelines and checklists that can be used to really try and be as safe as possible. Ideally, including parents, including communities in the whole planning process, not only to address their concerns, but also to engage them into making sure it's as safe as possible. That is what we can recommend. But from a youth perspective, perhaps Therese can also address because how young people would be dealing with this concern of being called back to school and not being certain whether it's safe or not.
Right.
Yes, there's a lot of concern, especially I want to address the primary schools because these children are so free-spirited. They eat food from the floor. They drink from the same water bottles. No, when their snacks fall, they pick it up and they say, okay, 5 seconds, they blow and they eat it. They eat it. They drink from the same water bottles. They might even be sharing masks because your mask is cooler than mine, or my favorite color is blue, but I have a green mask. Let's share. And that is really problematic. But I've noticed that schools in Thailand, they're doing some really great work, especially in daycares, to facilitate social distancing by really compartmentalizing play area from work areas, and they have many sanitizing stations and so on. But the reality is that not a lot of schools, especially in the Caribbean, especially in Trinidad, they have limited space as well as limited resources, so they may not be able to physically facilitate these things. So what I think is really critical is education. Educate students, educate them so that they know it's okay if your teacher doesn't hug you. It doesn't mean that she doesn't love you. It's okay to not share your food with your friend. It doesn't mean that you're greedy, or just because your friend doesn't share her snack with you, it doesn't mean that she doesn't want to be a friend anymore. And it's really important to include parents in that conversation and in that process, because it's a holistic approach that we have to take, because that sort of education is something that they need to learn from now. I mean, from even the start of the pandemic, really, because you can't just spring this upon them, and their parents really, they are at the core of educating them where these things are concerned.
Thank you so much for that, both. We've had a couple of questions come in from the audience that I'd like to address. Firstly, and I think this is one for Therese, it's from Lisa Bailey from Barbados. Do we think that Caribbean youth are taking COVID seriously?
That is a really important question. To be honest, I think that a lot of people, not just youth, are not taking the pandemic seriously enough, because I noticed that people are not wearing their mask. If they're wearing their mask, they're not wearing their mask properly. It is under their nose or just hanging on one side, or they're eating with their hands dirty and all these different things. So really it points that we are not necessarily taking the pandemic seriously. And I think that a lot is being done to try to educate, because there's so many campaigns on radio. There's so many, trendy songs about adhering to the health requirements and the protocols. Social media is littered with all these different ways in which you should, be responsible for your health and well-being and that of others. So I'm at a point where I'm not sure what next we should do, but it is definitely clear that we are not taking it seriously. And I wonder if it is because we've been sort of, and I say this here very carefully, we're sort of lucky compared to other countries and other territories where there is a high proliferation of cases and so many deaths. So I think that we're taking our fortune for granted, and it's not something that we should do because of community spread, and it is happening. So it is necessary for not just young people, but for everybody to realize that this is no joke. There's a saying in Trinidad, God is a Trini. I might sometimes believe that as well, but it does not exempt us from being responsible in everything that we do, because this pandemic, like I said earlier, it does not discriminate. And you don't want to be on the other side of the conversation, having regret and saying what you could have and what you should have done, but you didn't do because you were irresponsible. It really means that we need to take responsibility for our own actions as well as that of other people. So if you're in an office or if you're in a space, you can politely tell somebody that, I see you wearing your face shield, but are you aware that the face shield doesn't really protect you as a mask does? The face shield only protects your eyes. So it's recommended that you wear your mask as well. So it's a collective responsibility, but especially individualistic, because people would take stock of everybody else doing the right thing or doing the wrong thing and follow suit.
So you feel like maybe in the Caribbean there's a little bit of a false sense of security because of current case numbers?
Yes, absolutely.
We've had, I don't think it's just the Caribbean, we've had another comment from Mohammed Hussein who says, 80% of infected people are asymptomatic, and young people in Bangladesh, which is where he's from, hate wearing a mask. So there's a bit of a vicious cycle with people who might have COVID, but who are one of those asymptomatic patients, not following the recommended public health measures and spreading it All right. So I don't think it's just the Caribbean, but it's good to hear that sort of anecdotal evidence from young people from various parts of the world. We've had a question from Tati Rodriguez from Curacao. I think it's probably a Sonia question, but Therese, if you want to jump in as well, please feel free. So in Curacao, there is, according to Tati Rodriguez, no local transmission of COVID-19. The next week after summer break, schools will reopen, which have been mostly closed since March. Now, we suspect that many young people have experienced stressful moments at home during lockdown, including abuse. How can we screen and deal with mental health issues once schools reopen?
That's an excellent question, and I do hope that Curacao will maintain that status of no local transmission, but it's important to remain vigilant, right? And keep maintaining the prevention measures, being compliant, and maintain vigilance in terms of diagnostics and observation. But when it comes to the mental health of young people, I think it's critical that in part of the plan for reopening includes how we will address young people's mental health. And there's different levels of addressing it. One, to make it, to very specifically open the dialogue with young people. In every class, have a dialogue about how have you dealt with COVID-19? How are you still dealing with the measures? What can we do to help you? That to acknowledge that there is there might be these feelings, and open the dialogue. Tell young people we are open to help you, to discuss. This is not a secret, this is not a taboo, but we are all dealing with it together. And then in addition, to make sure that there are specialized mental health services available on call or in the school, and that could be from counselors, psychologists, psychiatrists. Make sure that you plan that ahead, because as the person who's asking the question says, this will be an issue. And so it's very important to plan the different levels, the conversation, the dialogue, but also the specialized services for those who will need it.
We're sort of reaching the last 10 minutes of this session of Ask the Expert, and we've spoken a lot about the challenges being faced by young people in the context of the COVID-19 pandemic, and that's, ranging from mental health issues and feelings of anxiety and isolation and loneliness during public health measures and lockdown, challenges with continuing education, challenges going back to education. Young people at the moment are dealing with such a huge array of issues. What are our recommendations? I don't know if you want to start this, about what young people should do in response to some of those challenges within the context of COVID-19.
Maybe in summary, some of the things we mentioned is that young people should, first of all, the best way to deal with questions is to create your own answers. And I think Therese said it very nicely, for young people to take control of their own lives, and make sure that they deal in a positive way with these challenges. A big part of that can be to help others, to look outside of yourself. And so we are encouraging young people to participate actively, not only through compliance with the prevention measures as a person, but to see what they can do to contribute in their communities. I think that helps young people, and we have some examples. There are some very nice videos that the Caribbean office has been publishing over this whole week, of young people who have taken action. It can be a small thing to help a neighbor. It can be participating in a broader response. And all these young people say, it has helped me as well. And so I think that is very important. And that links back with the topic of International Youth Day, engaging. For young people to engage, I think that is a key. The other one is to educate yourself. Therese mentioned it. I think the one-on-one action can be very critical. If I may take a little detour, having worked in HIV for many years, this just reminds me of the time when we were promoting condom use and how young people did not want it. And it took sustained action and trying many different ways to reach the audience with the messages and the one-on-one and the examples that we set by our own behavior that will convince others to also do the right thing. And so those are some of the things that I would recommend for young people to take action, to take control, to contribute, to be an active part of the response in their societies, in their communities, and learn from each other. Oh yeah, and finally, what I think is very important, I do want to address this whole issue of the infodemic, where young people especially are exposed, relatively more exposed to this avalanche of information that is on social media, information and misinformation. And so make sure that you limit your use of social media, but also that you're not part of the process to propagate misinformation. Educate yourself and use the proper information to inform your own behavior and to help your community.
And just following on from that, if you do see something on social media that sounds a little questionable and there's an awful lot of it, you can go onto the websites of the Pan American Health Organization or the World Health Organization. Many countries' ministries of health also have websites where you can find accurate information about, the real evidence behind COVID-19, the real risks. And there's a lot of resources as well on Paho and WHO's website for addressing the infodemic. I don't know if you want to add anything, Therese, about what should young people be doing really in response to these huge array of challenges posed by COVID-19.
There's this saying that says, don't let a good crisis go to waste. Crisis equals opportunity. So I would encourage young people or old people or everybody, use it as an opportunity for growth and development. It's kind of like rejection or bad news or a bad breakup. I mean, I don't mean to oversimplify it, but in that situation, what are you going to do? Are you going to sulk and sit and sulk and eat fast food all day? No. Groom yourself, take care of your skin, start swimming, pick up that old book that you have not completed, stop procrastinating on your business plan, register it. In fact, I think this pandemic has shown us how volatile the world of work is. You can be let go, you can be retrenched. So don't wait for your job to tell you that you're not essential. You make yourself essential and create your own opportunities. Crisis equals opportunity. At the end of this pandemic, it would be really great if you can actually see how you spent your time and what you got out of that.
Thank you so much. And Sonia, what's Paho doing specifically to support young people get through all of these challenges?
Thank you for asking that, because that allows me to make a little plug for some of the things we are doing. During May, June, Paho and UNICEF have organized weekly youth hangouts, one in English, one in Spanish, and especially the English one was, we had good participation of Caribbean youth. 1 hour a week to discuss COVID-19 and their questions and their issues, their concerns. The hangouts are led also by young people. Therese also helped co-facilitate some of those sessions. And we took a little break in July, but we just started again yesterday with the youth hangouts every other week. And so the next one is on August 26th. We have from 2 to 3 in the afternoon, Washington time, the English hangout, and from 4 to 5 Washington time, the Spanish hangout. So I would invite all young people. Sorry?
Can anyone join?
Yes, please. Please follow the Paho social media for the links to connect. It's young people speaking to young people, and so we warmly invite all young people to participate. In addition, a very interesting event was organized by the joint UN agencies. We conducted a survey among young people to hear what their issues are, their concerns, how COVID-19 has impacted them. And we received more than 8,000 responses from young people to that survey. The first results will be presented today, so we invite everybody again to join. It's at 12:30 Washington time. And so you are very welcome to listen, because that will also inform our actions, not only as UN partners, but everybody who is working with and for young people, including young people. So those are some of the things that we are doing. We have a lot of material on our website for young people, information material, and we invite everybody to download that material from the website and use it in your own work. Use it on your own website. Share it with young people. So those are some of the things that we as PAHO are doing to support young people to get through COVID-19 the best way possible.
And if I'm interested in joining the presentation for when the results are going to be discussed at 12, I think you mentioned it was 12:30 EST, yes. Sonia, which is Washington, yes. DC time. How can I join that?
The link, there is we can share the link in the chat, so people can still register, because it does require registration. So there's still time to register and join it will be a Zoom event in a little bit, a few minutes.
And is that 8,000 young people from across the world that have
invited? No, from across the region only.
Oh, wow.
Because we issued this survey in English, in Spanish, in French, and Portuguese. And it's very interesting for Caribbean youth, because we also had good number of responses from Caribbean youth. So please, everybody, join and listen and help us. We will send the link through the chat, and please register and come and listen to the results.
Brilliant. So I just have one final question for both of you, really. And we've spoken a lot about, what our recommendations are for young people to deal with all of the challenges that they're facing in particular. But we know that the vital role of young people goes way beyond that. And that they actually have a role to play in helping to stop the pandemic, essentially. So I guess, in a nutshell, very briefly, what do you both think are some of the primary actions that young people can do to really help stop the spread of COVID-19 in their communities and countries? Should we start with Tere?
Yeah, of course, by all means. I think a good place to start in terms of the young person is to actually embody and personify what a compliant citizen should be doing and should be representing. So it means that you should wash your hands frequently, wash your hands properly, wear your masks, and make sure that your environment is clean. Yes, Sonia, I see yours is very lovely.
Yeah.
Very lovely. Oh, okay, lovely. So it is critical that you wear your mask, and when you see others that are not wearing their masks, you can politely tell them that, this pandemic is real serious business, so to protect you as well as me, let's wear a mask. I think taking personal responsibility for actions are very critical, and really encouragement and education is key. We can use our platforms right now, which is our voice to start off, which is our family, household, our own community, and even social media, to encourage people to do the right thing and call people out when they're not doing the right thing. But that does not mean that you have to berate or really embarrass anybody, because it's a learning process. It will take some time, but it is critical that we really get that ball moving, because we really need to flatten that curve.
Brilliant. And Sonia?
Yes, I want to close by challenging our young people to participate in the Wear a Mask global challenge.
Everyone.
Yes. I am wearing my mask. I actually made this one myself. So that's a little hobby that I took on, working from home. And so wear a mask and participate in the global challenge, take a picture, and upload it, hashtag share it, hashtag wear a mask, and also hashtag Paho, tag Paho, so we also know that you are participating, because this global challenge really speaks to what Therese was saying, to give a good example and to show that it can be fun, to do the right thing.
Brilliant. Thank you so much, Sonia. So we've come to the end now. I just want to let you all know that the links that we discussed are now in the chat. So if you would like to access the group tomorrow, I believe you said, Sonia, or the webinar, which will be taking place
Today.
Yeah, in 40 minutes, in fact,
Yes.
very shortly. Then you can join with the links that have been posted into the chat. So I want to thank you both so much for taking the time to join us in this session of Ask the Expert. It's been hugely valuable, and I hope that the conversation continues in the chat throughout the rest of the day, and obviously in the session tomorrow and the webinar today. So thank you so much, Sonia, and thank you, Therese, for joining us. And we will be back next week, same time, same place, with another edition of Ask the Expert in Spanish and English. So keep looking at our Facebook page and our Twitter to find out more details about that. Thank you. Bye-bye.